Hi guys, welcome to my YouTube channel. It's Dr. Judith Ebengho here again. Thank you so much for tuning in. I was in clinic this peaceful day and we were trying to counsel a patient who was going in for surgery on what she needs to do so that the procedure is a success and everything. So we got to the part where we would ask, like we routinely do, and ask, oh, ma, please, are you hypertensive? And she goes on to say yes. So we're like, oh, what medications are you on? And she says, oh, I don't really take my medications, I only take them when I have headache. And something went off in my mind. It's like, you do what? You do what? So I was like, she was like that she doesn't think she needs them, she only take it when she has headache and everything. I was like, okay. Then this made me remember another patient that we saw, and this woman doesn't even take her medications at all. And I'm like, why? Is it that people are not informed? Is it that they don't know that when you are placed on hypertensive medications, most times, like 9 times out of 10, you have to use it for life and you have to take it every single day? Apparently, maybe people don't know. That's the purpose of this video. So in case you see me looking down, I am trying to look at my notes. Yeah, I'm just trying to check out a few things so I don't miss out anything. Also, it would be worthy to mention that I would be doing this in 2 versions of this video. One would be in English, that's this one I'm making. Another one will be in Pidgin, so watch out for it. So yeah, according to the WHO, 46% of adults are unaware that they have hypertension. 46%, guys. So that means about 4 to 5 people out of 10 are unaware that they have hypertension. And this is why hypertension is known as the silent killer, because people have it, it's doing a lot of damage in your body and you do not know that you're even hypertensive. Hypertension is a major cause of premature death worldwide. This is from the WHO too. So I'm sure that you've heard of people who just say, oh, this person slumped and died, or this person died in their sleep, things like that. Most times when you look at the root cause of some of these illnesses, especially people who just collapse, they say, oh, this person slumped, most times they often have high blood pressure. So going to now say, like, educate you guys, what exactly is high blood pressure? This is when simply put, blood pressure, this is just the pressure with which your heart pumps blood to the rest of your body. So that's the pressure in your vessels, that's, you know, your veins, your arteries and everything. That's the pressure, that's the blood pressure we're talking about. But when we now have high blood pressure, it means that there's a normal, there's a certain pressure with which your heart should supply blood to the rest of your body and everything. There's certain pressure that should be in your vessels. But when this gets higher than normal, then we say someone has high blood pressure. Usually people, it's usually 140/90, but I'm not going to bore you with all of that. But once a diagnosis of hypertension is made, then it means that the normal pressure you're meant to have in your body has gone above the normal limit. So I'm very sure that the next question in your mind is, how would I know that I have high blood pressure? The only way you can know is to check. Yes, there are signs that some people would have, but still it doesn't have there's no one thing that you would see and say, oh, this person has high blood pressure. No, you have to check. This is why your routine screening is very, very important. So how do I even check? You know, when you go to the hospital, there's this band that they put on your hand, like we call it a sphig, a sphygmomanometer, but for short, sphig. So they put it and then just measure, they inflate it. You can feel it getting tighter around your arms, so they inflate it and then check your blood pressure. So the only way you can know if you have high blood pressure is to check. There are no 2 ways about this. But then some signs that some people may come down with, some people may have nosebleeds, that's bleeding from their nose. Some people may have headaches, dizziness, and all of that. But really, you just have to check to know. So next question, I say, oh, I've checked and they've told me I'm hypertensive and everything. What do I do? Really, you have to speak to your doctor. You have to make sure that you're seeing a specialist. I do not advise people just going online and then using the information they find online to treat themselves. Someone has to assess you physically. Someone has to see you, know how you're doing, do certain checks. There are certain routine checks that you have to do periodically if you're hypertensive, and then just generally as an adult, there are certain routine checks that you have to look out for. So if you have hypertension, please see a specialist. Let them recommend what you need to do and how you need to go about treating your hypertension. What are the risk factors? Why would some people come down with hypertension and then some people somehow do not come down with hypertension? Why does that happen? So usually when it comes to risk factors for developing a disease, most times they're divided into two broad categories. Yes, so we have the modifiable risk factors and then the non-modifiable risk factor. Modifiable means that you can actively do something about this to prevent you from developing a particular illness, while non-modifiable means that there's really nothing you can do. It is what it is, right? There's nothing that can be done about that. So for the non-modifiable risk factors, usually hypertension is seen in older people. So if you're becoming advanced and everything, there's nothing you can really do about getting old. So yeah, but also I want to deal with one myth that people have about hypertension, that it's only old people who can develop hypertension. That's not true. That is really, really not true. There are a lot of young people coming down with this illness. A lot of young people, and what is sad is that a lot of young people, since they believe that they cannot have this disease, they come down with complications of hypertension. So you see young people having stroke. Yes, you see young people slump and die, basically. You see young people developing kidney failure because they've had hypertension for a while, and of course nobody looks out for it because you don't think it is possible, and before you know it, people are coming down with the complications, which is just really sad. So yes, hypertension is more common now in the older age group, but still, as a young person, you need to get checked because there's still a possibility that you may have this condition. Then another non-modifiable risk factor is your genetic makeup, your who you are. There are certain genes that have been identified that may predispose to hypertension. So if an individual has any of these genes, it's just what it is. There's nothing they can do about it. And also it has been often found to be familiar. So sometimes you just find it in families, and if you come from a family where someone already has the illness, maybe your mom, your dad, and maybe a sibling, one of the siblings already has it, there's nothing you can do about that. They have it is they have it. So that is that for the non-modifiable risk factors. There are others, but let me not bore you with that. Then we have the modifiable risk factors. First, if like someone who smokes, now smoking has been linked to predisposing people to hypertension. So if you smoke, you're at higher risk than the rest of the population, and the good thing is that it's modifiable. You can stop smoking by undergoing programs that help with smoking cessation. Another modifiable risk factor is someone who is obese, and obesity has been linked to a lot of illnesses, guys. You in fact, I don't know how, I'm trying to find the words to describe obesity. Obesity can lead, in fact, if they ask you causes of this illness, you will not be wrong if you said obesity and smoking. You will not be wrong, because these two things have been implicated in a lot of illnesses. So yes, and the good thing with obesity is that you can always try out weight loss strategies, plans, diets, different things just out there. So you want to make sure that you try and reduce your weight to a more healthy level. Another risk factor would be a sedentary lifestyle. These days, people just sit down. In fact, I am guilty. You just want to sit down and be comfortable. In fact, I'm shooting this video and I'm sitting down, and I'm thinking in my head, is there a way I can shoot my videos standing? So I tend to like move around and not just be sedentary. So a sedentary lifestyle is something that has been implicated with developing hypertension. Also, lack of physical activity. I think I can also link this with the sedentary lifestyle and everything. So all of that, these are things you can do something about. You can modify these risk factors. You can yes, you can do something different. So why not try? If there are any of these factors that you feel, oh, I need to work on this, or I need to do this better, then why not? Then another modifiable risk factor is your diet, but I'll talk more when I get to prevention. Hi everyone, so this video has to stop here because it's getting too long and I don't want to bore you guys with all the details. However, there will be a part following this, so watch out for the next part of this video. Thank you so much for staying till the end. See you next time.